Good morning, friends. Welcome to my channel. My name is Dr.Devasis Meher, and I am the Managing Director as well as Medical Officer at Divyan Yoga and Naturopathy Wellness Center. So, friends, today I am going to speak about vitamin D and its deficiency, which leads to joint pain and many other problems and complications related to joint pain. So, let's get started and just take away certain insights which is very important for you to know and maintain a good health by fulfilling the deficiency which is concerned with your vitamin D. So let's get started. Firstly, vitamin D and your health. So in this, vitamin D is called the sunshine vitamin for good reason. Not only does your body make vitamin D when your skin is exposed to the sun, but we also know vitamin D can ward off many health problems. Vitamin D is a naturally occurring component that regulates the body use of calcium and phosphorus. It's crucial for formation of bones and teeth. Because vitamin D is so important to bone growth, some researchers have wondered if supplements can help joint pain. So, secondly, does research support vitamin D as a treatment for joint pain? So, in one study, we found that patients living with chronic pain who were deficient in vitamin D were the most likely to benefit from taking vitamin D supplements. However, more information is needed to determine whether vitamin D supplements can help everyone living with chronic pain. In another study, predicted that adults with vitamin D deficiency who are older than 50 are more likely to develop pain in the hip and knee joint. The study has noted that the pain is more likely to get worse if the deficiency isn't treated. Then next, the study looked at vitamin D levels in people who have rheumatoid arthritis, an autoimmune condition that causes the body to attack the joints. This study found that most of the participants has low vitamin D levels. The researchers conclude that the low vitamin D levels were a complication of rheumatoid arthritis. Other studies concluded that people with rheumatoid arthritis low vitamin D from these corticosteroid medicines. However, a study of postmenopausal women, a group frequently exposed to joint pain, found that total daily vitamin D and calcium supplement did not improve the joint pain. Why do we need vitamin D? Perhaps best known benefit of vitamin D is that it strengthens the bone and the teeth. Before vitamin D, we routinely added to food, include milk. Children were at the risk for a condition known as rickets. In adults, vitamin D ward off osteomalacia, soft bone, and osteoporosis, loss of bone mass. People with vitamin D deficiency are more likely to expose infection and insulin resistance. Some studies have linked vitamin D deficiency to coronary artery disease. And next we will see how can we prevent vitamin D deficiency. For most people, the recommended daily allowances of vitamin D is 600 international units. Babies up to 1 year of age need 400 international units, and adult older than 70 should have 800 international unit of allowances. Your food and from sunlight you should get this. Next, eat right food. Food is the best way to get vitamin D. In food like dairy, cereals, and many other food like mushrooms are good source of vitamin D, and many different variety of fishes which gives you vitamin D daily in a serving basis of 750 international units, and you get 366 international units of vitamin D through sunlight exposure, and through fortified food products you get 120 international units of vitamin D, and through canned oils or any sort of sardine fish you get 46 international unit of vitamin D. And there are many other miscellaneous sources from where you get vitamin D. So friends, let's see how to get some of the vitamin through sun exposure. Sun exposure is the second significant source of vitamin D. Ultraviolet light start chemical reaction in the skin that produce a unstable form of vitamin D. How much vitamin D your body produces changes with the environment and how well skin absorb vitamin D. Those with darker skin need more sun exposure. The right dose of sunshine for getting vitamin D is harder to estimate, however, depending on skin color and how well you absorb vitamin D. Aim for about 5 to 30 minutes of exposure in between 10 am and 3 pm, at least 2 times per week. This exposure should be to the face, arms, legs, or back without sunscreen with SPF of 8, higher blockage vitamin D production of ultraviolet rays. For some people, a supplement may be needed regardless of the amount of time in the sun. Talk to your healthcare provider about your vitamin D levels. If you work at the office job or take an area doesn't have a lot of sun exposure, purchase vitamin D lamp which happens to get too much of vitamin D. It's very rare, but overdose can potentially be very serious. Vitamin D toxicity is most likely to be caused by taking too many supplements. Taking 60,000 international unit of vitamin D for several months are cause of vitamin D toxicity. This is about 100 times the typical adult recommendation daily allowances of 600 international unit. People who have certain health problems may need less vitamin D than the average person and be more susceptible to excess levels. Your body, regardless the vitamin D amount it gets from sunlight and food, it's difficult and different to get too much vitamin D from the sun. The biggest risk of sun exposure is vitamin D cancer. You should wear sunscreen with SPF of at least 15 before going outside the sun. Sunscreen should be reapplying every 2 hours. Vitamin D toxicity can lead to a buildup of calcium in your blood. This is a condition known as hypercalcemia. These symptoms include poor appetite, nausea, vomiting, weakness, frequent urination, kidney problems, etc. The primary treatment reduce or discontinue use of vitamin D supplements. In extreme cases, fluid and medications may be necessary. Takeaway: people who have low vitamin levels of vitamin D often have joint pain. Vitamin D supplementations may treat joint pain in some people who have vitamin D deficiency. However, research doesn't support the people with healthy levels of vitamin D should take these supplements for joint pain. So with this, I will take leave from you. See you next time with many other interesting and new topics. Till then, take care.